Dear student, today we will discuss about the important topic, that's patient education regarding the subject community pharmacy. Anyhow, a little touch should be there related to the previous lecture, in which we have discussed too much detail about various medical complication, and it we mentioned that basically all those problems that basically which occur due to treatment, due to already the existing illness condition, or that may occur due to the operative condition. And then basically we give a detailed discussion, and then we give a detailed touch toward all those problems that we are basically emerging. Let's suppose during the operative condition, okay, let's suppose there is no proper hygiene, we discussed, so obviously there will be spreading of the infection chances will be there. Okay, and so many other problems we have discussed into detail. Then we discuss various medical complications that occur due to already existing illness condition. For instance, we discuss in detail those problems related to the cardiovascular problem. Let's suppose a person have atrial fibrillation, so there may be chances of the thrombosis and emboli formation, chances may be there, so we have to discuss in detail. Then we discuss about the diabetes, that may be type 1 or type 2, but these conditions have a direct effect on the respective organ system, and that may be in the form of the, we discuss in too much detail, there is the peripheral neuropathy, okay, there is retinopathy and nephropathy. Too much discuss, we have discussed in too much detail. So as for today lecture is concerned, so there is the patient education. So of course it's too much important that we should have to share the, yes, of course, the information regarding the patient condition. That is too much important for the patient care, and also important to develop patient satisfactions, because patient satisfaction, that is too much important, and for that it's important just to share the information and to educate the patient and to share information regarding the illness condition or whatsoever, regarding the treatment protocol, because this play a very important role, and we should have to share in order to develop the patient satisfaction. One thing keep in mind, unfortunately patient education is not an easy task. Health information is complex, and patient can easily become confused without the proper educational resources. Doctors, clinical trial professionals, pharmaceutical representative, and other health educators may find teaching patient about medical issue difficulty. But one thing keep in mind, it's mean that a lot, yes, of course, a lot candidates are basically directly involved while educating the patient, just to share the information with patient, and that may be even the, of course, a doctor, that may be even a nurse, that may be even a pharmacist, pharmaceutical representative, professional, trial professional, depend upon the area where a patient may be involved. But anyhow, yes, of course, the main objective is to properly educate the patient regarding the all aspects, that's patient have, that is the disease condition, the treatment protocol, the investigations, and what should be the coming strategies regarding the condition. That will be too much helpful regarding, okay, and the main objective is to develop the patient satisfaction. So of course we have top 5 tips just for the better patient education, and those tips are: the first one, demonstrate and trust and establish trust. So when teaching patient about medical issue, it's important first to establish trust. So we should have to, it's important for the provider, just that may be anyone, and just to, yes, of course, establish trust. So of course, yes, of course, show them that you are interested in more than just their physical well-being. Of course, that I am thinking just for you and for your better interest regarding the your, yes, of course, disease condition. You cover the condition, you, of course, that's too much important, and you, of course, you have to satisfy the patient, and by demonstrating in a very good way in order to establish your trust. So of course, making it less likely that they will tune out your words. Some way that you can demonstrate your interest in patient include, yes, of course, the first these are ask how things are going with their work, hobby, home life. Just you should have to just give 1 to 3 minutes to the patient and share just general information. General discussion should be there, okay? And the next one, see if they have been any very interesting recently, or if they have upcoming travel plan. So of course we should have to share regarding the patient. Let's suppose general discussion should be there, okay? Find out if they have read any good books, or let's suppose if they have interest in any good books or just TV program, so just to share. Yes, of course, patients who feel cared for and heard will be more receptive to education provided them. In addition, investing a minute or two of non-medical conversation can help the patient, put the patient to be at ease. Of course, if let's suppose anyone that is the provider, I mean, that may be a doctor, maybe a nurse, maybe a pharmacist, okay, maybe other related to other any field that is like a trial one. So if we share just the general information, we share just a general, give 1 2 minutes to the general discussion. So through this general discussion, we put the patient in ease, making them open or more about any problem, medical issues or worries they might be facing. So let's suppose if we just go for the general discussion, so of course the patient will share a lot of the uh, things, especially how in, yes, of course, share with the provider, and there's too much helpful regarding the strategy, just to make strategies regarding the treatment protocol. The next thing that is, uh, of course, that's too much important, and adopt to the patient learning style. So of course that it's too much important for the uh, for the provider just to start a discussion in a very good way in a respective language, so that the patient can easily, of course, learn the things, can easily pick the points, and never bore. And that's too much important, and just to start to discuss all the things in a very good way, that's too much important. So yes, of course, adopt the patient learning style, that's too much important for the provider especially. And one thing keep in mind, of course certain barriers are there. Yes, of course, those barriers can include like language, culture, level of formal education, and even misinformation that the patient received from the other family members and whatsoever. These are too much important, okay? So we should have to minimize those barrier in a proper way. We should have to start a discussion with patient so that he can feel easy and he can pick the points regarding the problem. Some patient will already know that what kind of learner they are, visual, auditory, depend upon the situation. Let's suppose visual way of learning is easy for them, or auditory, so whatever depend upon. Yes, you should have to adopt that way for the better interest of the patient, in order to for the, yes, of course, in order we should have the better outcome. That's too much important. The next one, that is use innovative and age appropriate education material. Yes, of course, patient education materials come in all form, different form. There is the new words, innovative formats, and also, yes, of course, some traditional methods are there. So depend upon the, yes, a patient, and what method they basically like. So of course we should have to follow both the methods, that is the new updated as well as the traditional trifold complete methods or video. Yes, we should have in the waiting room. These are too much important for the patient. We should, yes, of course, these are too much important. The next one is ask patient to explain information. Yes, one thing keep in mind, that's too much important. Where one, let's suppose if a doctor give 2 3 minutes just for the general just for general discussion, and of course then depend upon the condition, yes, should adopt the patient style condition and to discuss in that way. Let's suppose if a person is too much depressive or suffering from MDD or yes, schizophrenia condition. So yes, of course, the patient have to discuss in a very open way in order the patient share all the information. And there is the of course a feedback should be there from the patient side. Okay, what the patient discuss, the yes, the provider discuss into much detail with patient. So feedback should be there from the patient side. And sometimes the reason why a patient may say that understand something when they don't, yes, of course, sometimes the patient say that yes, of course, he understand everything, he learned all the things, but yes, of course, sometimes problems are still there. That's why reason is there. They might be in shock, okay, or weaned by a diagnosis, and just want to leave, just certain conditions that's worry the patient, and he just want to leave the yes, the area especially. They might be too embraced to admit that they don't really understand it. Yes, of course, if just that's why they mention that I understand each and everything. They might genuinely think they understand it, but realize that they forget. Yes, of course, they know that they realize they know everything, but sometimes maybe a problem will be there. So that's too much important. While the main objective of this feedback is just that, let's suppose if there is some shortcoming, or let's suppose some problem is there, okay, so obviously the provider, the doctor may correct those problem, and just to share the right the exact information. That's too much important especially. And the next one, that is education, educate the patient, family, or caretaker. So this is too much important. Two minds and two memories are better than one. So of course, this is this is, yes, of course, universal truth. So that's too much important. Let's suppose if the patient have the friend, or let's suppose have the family member, so you should have to share those information along with patient. We should have to share those information with the family member, because this while sharing this information with the patient family members, or let's suppose sometime maybe the friend one, because the patient may have the capabilities to share information in front of the family member. So of course, if friend is there, so we should have to properly educate and share the information with the patient family member or the friend, because that's too much important, okay, for the coming time especially. One thing that's too much important, and we discuss in detail, is of course we should have to properly educate the patient in a different way. But one thing, keep in mind that who is responsible just to educate the patient. So of course, uh, yes, these are too much important. Healthcare professionals, administrative staff member, yes, prescription drugs manufacturer, yes, doctors and patient themselves. Yes, of course, these are too much important just to educate the patient. So one thing on priority basis, we have the first one, that is the office staff. So official, okay, office staff, yes, of course, too much more than make appointment and file. Not only to focus on the chart and just to make an appointment. Yes, of course, they should have to key this. They should have to show their interest regarding the patient. That's too much important. The next one, that is the doctor. The word doctor originally come from the Latin words for teacher. So today the role of educator is still important for both primary and physician, for okay, and specialist. Patient look to doctor as to expert in healthcare, and doctors have a duty to help their patient and to understand and what is going on with their health. That's too much. So of course, the doctor should have to share all the things. Nurses, of course, most of the time, patient may have most of the time with nurses, so nurses should have to share the information in a very good way, in a very good environment especially. And there is the clinical trial professional. So of course, sometimes we have some patient in a trial way, and of course we should have to, yes, they should have to share the information that this is basically what's going, this is for the better interest of the patient. And pharmaceutical professionals, so of course new drugs come toward the market, so of course a pharmaceutical representative should have to share in the latest information regarding any drugs or whatsoever. to the patients in order to develop the patient interest. Patient obviously have a vested interest in their own care, and most of them wants to learn how. However, many patients may not know who to trust. Okay, that's the misinformations that rampant spread by family member whatsoever. That's too much important. So that's why the patient have to show a keen interest while paying all these points which I have shared by all these candidates for the better outcome and for the better treatment. That's too much important for the patient health and for the patient care. So as I'm thinking, I think this is sufficient for today, and inshallah the remaining we will discuss in coming class.